Recording in progress.
I'd like to call the Health and Human Services Committee meeting to order. Let's start with the Pledge of Allegiance. I pledge allegiance to the flag
of the United States
of America,
to the
to the republic
that stands
one
one
nation, under God, indivisible, with liberty and justice for all. The agenda tonight has 14 resolutions. We don't have any appointments. We have 5 health department resolutions, 3 from social services, 4 from mental health, and 2 from the office for the aging. If I could get a motion to approve the minutes of April 13th.
I'll
That'd be
move
great.
it. I'll second.
All in favor?
Aye.
Aye.
All right. I was gonna let Debbie go because she doesn't have any resolutions, but she does have information that she included for her report. Looks like Youth Bureau is going to be getting additional money for reappropriation of youth development funding and new funding that includes $10 million, not for Cayuga County, but statewide youth sports grants. And she'll fill us in with more information about that. If we want to, why don't we just get started with the health department?
Elaine, can I say one thing?
Sure.
I want to thank Heidi and Lydia for being on this youth board. They've done a lot of work to get this done. And thank God we got Deb, and it's really going to be a success. So thank you, Heidi. Thank you, Lydia.
Thank you, Chairman.
Sounds like the first meeting was pretty good.
Absolutely productive.
Oh, great. People had ideas to share and
Absolutely.
great.
People didn't want to leave.
Oh, wonderful. Okay,
You like this committee, right?
do you want to start with the resolutions, Kathleen, or you want to?
However you want to go through it.
All right, let's get through the resolutions and if you want, would you start with HH1?
Sure.
It's a request to create the job title and then fill the role of Director of Environmental Health Services. This is pending the retirement of our current Senior Public Health Engineer who functions as the Environmental Health Director.
Can I get a motion?
I'll move it.
Second?
Nightingale second.
Okay. So any questions? I guess, if this passes, then eventually at some point, the senior public health engineer will be vacated after the crossover of 140 hours.
Correct, I am requesting that.
And that the title change will be effective as Director of Environmental Health
Yes,
for this new position holder.
yes.
and you've worked with civil service and you've got it established as a grade 6, and at some point they'll look at the candidate and come up with a salary.
That is correct.
And this is part of your planning for the, the exit of Eileen O'Connor.
All right.
A lot of questions in there.
Yep.
Yes, I do want, just for clarification.
To lay the groundwork. And, you know,
Yeah.
I know we speak about it a little, we spoke a little in January, spoke a little in February, and I think this committee probably is well informed, but it's good to kind of refresh, I think, why we're doing that.
Any questions on that?
Madam Chair, I just want to say that I spoke with Kathleen earlier this week, knowing that I wasn't going to be there, and she did a very good job of filling me in on all that was going on, and that will keep me from asking many questions today. Thank you.
All right, thank you. All right, all in favor of HH1?
Aye.
Any opposed? All right, great. If you wanna, we'll group together HH2 and HH3, and you can go over them, and I'll get a motion for both of them. They're accepting additional money, both one for the septic program and the other for the youth tobacco enforcement program.
I'll move it as a bundle. I'll second.
Okay.
I don't really have anything else to add. A2PA is the Adolescent Tobacco Use Prevention. And the septic system replacement program is for those people eligible around Owasco Lake, Cayuga Lake, Lake Como as drinking water sources.
I was originally confused when I was starting to go over the resolution, but the original appropriation in 2023 was the 500 and some odd thousand. We got 380,000 more, and that's what this resolution will do, is amend that amount.
Yeah, and it was before it became new in the contract. So it wasn't like here's addition. Sometimes we try it in the resolution and any additional funding, but it wasn't one of those things.
Great. Okay, we have a motion and a second for HH2 and 3. All in favor? Aye. Any opposed?
Elaine, can I just say something? Legislator Basile had a lot of questions regarding this. And Kathleen got back to him with a long email and explained the whole thing, and I appreciate that very much.
Yeah, I'll just add as a sidebar, one of our staff members, Michelle Murphy, is a sanitarian. She was asked to go to the Conference of Environmental Health Directors and do a presentation on the septic system program, not just the replacement program. And that she's got a PowerPoint that's put together. I'm thinking that might be useful perhaps for the Board of Health, or even this committee might have interest in.
Yeah, because Jim had a lot of questions about the sanitary code and the role of the health department in the septic program.
I think it would be great because it gives some history as to why it developed over time.
Okay,
So I'll run it by you before we do that, but I think it could be useful.
right. HH4,
So HH4 is it is our preschool transportation bid, and it's a request for us to go with the lowest bidder. This was a process, and you can see the various routes that are spelled out here. We did, just to offer you all the information, this was, we worked through a contractor, BMC, to help us get the word out for the bids out to these various potential transportation entities. We did get 3 bidders. Bernie happened to be the lowest bid for all the various routes that were out. There was one route that nobody bid on, and we're not looking to go back out to bid for that because of the low number of children who typically are engaged in that route. And I guess I'll wait to see what questions you may or may not have, but as part of the information, BMC, we asked them to do some analysis for us of the cost differentials. And on average, for what was bid by Bernie Bus, it's going to be about a 13% increase from our costs of last year. BMC did send me some information in the last 2 years that they've done with other counties for transportation help. And they've had those two of the particular counties were 25% increase and a 40% increase. So if it makes the pill a little easier to swallow, 13% is below average for what the other counties have had to make as an increase for this mandatory service.
yeah, I mean, it's definitely a lot of information to go through, but this was the lowest bid by Bernie.
Yes.
And this is what the recommendation was, to award The contracted.
Yeah, both by our analysis in-house and Rich Graham and Sharina Drosko are part of that. And also by VMC.
Great. Okay. We get a motion in a second for HH4.
I'll move it.
Nightingale second.
All right. Any questions?
I have a question. Do you mind if I ask what route is not being covered and what possibly we may be able to do to help with that?
So the route not covered is for children who may go into Wayne County for services. Typically, if those children are within the Red Creek School District and they're 4 years old, then they will be transported by the school, Red Creek School District. So for those 3-year-olds who do not qualify for that, we try to make an arrangement with the Red Creek School District if there are 3-year-olds who qualify for that. So we think we should be able to continue that agreement.
Thank you.
So just so the next resolution, you're going to talk about the permission to make these individual arrangements, and that's what that child would fall under.
And that's a perfect segue. Yes,
Okay.
we anticipate there could be, we'll call them the one-off situations
Yeah.
where a child may need to go to an even more specialized school. You know, many years ago, there was a child who would go to Geneva for a specialized school. Well, that's very rare, so we didn't put that as part of the bid process, but we would try to, you know, if a school bus is the way to transport this child, we would look to contract if the parent were not able to make arrangements themselves.
And then they give you the rate and you'd enter into the agreement.
Correct. That's what this next
Yeah.
resolution is a request for. And these would all go into effect at the beginning of the school year, which is July 1st, which is why we wanted to get them in this month.
Okay, that's a good segue to HH5, which is authorize the chair and the public health director to enter into agreements with transporters for routes outside of the awarded bid contract. This is basically what the authorization would be. You have the ability to make arrangements for these individual children.
Correct. And there is a cap on a not to exceed. So if there were some unusual requests that potentially exceeded, we'd be coming back to the legislature.
Oh, I see, not to exceed 1.5 times the rate charged under the primary transportation contract.
Yes.
Okay, all right. So someone would be watching that and you'd bring that back.
Correct.
All right. Can I get a motion for HH5 in a second?
Second.
Vote on 4.
Oh, we didn't?
You didn't vote on
Oh,
4.
all right, excuse me. Can we vote on 4, HH4? That would be the transportation bid through Verney Bus. All in favor?
Aye.
Any opposed? All right, great. Now we have a motion and a second for HH5.
Yep.
Okay, any questions? No, all in favor? Aye.
Aye.
Wait a minute, thanks. Is that Lydia?
You said aye, Lydia, right?
I did.
Yes.
I am looking for my notes, but I'm like, what I just did, I was gonna go over things. So I'm just gonna grab them.
Elaine,
I handed
Deb's here.
most of you the legislators who are here in person, a copy of our 2022 statistical report. And I thought I'd just put on a few highlights for you. Maybe I gave away the one I wrote on. But, I did a few highlights. If somebody has one that was highlighted, well, you got the one that I paged. That's okay. So you can see by the table of contents, we try to hit on a lot of our programs that are required and performed through our health department. And this doesn't encompass every single program we do, but certainly a lot of the ongoing programs that we perform. You can see that we've started an uptick in vaccines that we provide and the number of clients that we serve. We did have a pause on serving many of our children in-house in our clinics during the most intense years of COVID. So we've opened that back up again, and we have routinely scheduled vaccination clinics for school readiness. we've started to open back up into giving shots at the jail as appropriate through our Vaccine for Adult program. I think it's interesting when you look on page 4, tuberculosis, we tend to think of as a disease that most people have to be concerned about, but it is still something that, states often needs to be addressed. And in 2022, we had 1 active case. I'm pleased 2019 through 2021, we did not have any. We had been averaging when it comes to pulmonary tuberculosis. And then, so the related MAN2 test would be related to people who perhaps live in that same household or had a particular exposure to the positive person. And the home visits would be primarily for directly observed therapy, which has to do with medication that someone with pulmonary tuberculosis follows. There's some STI data. We are required, we do contract out our STI work. We have a couple contracts for that. We do still participate in a regional cancer services program. That's Cayuga County, Tompkins County, and Portland County for cancer service and breast cancer service and cervical cancer screening. We formerly did colon cancer screening also. We used to include prostate cancer, but that was really a bonus cancer screening. That's no longer available within our county. But I think it merits noting that within our county in 2022, not only did we have 61 people who had breast and cervical cancer screening, of that there were 13 who had abnormal results, needed some follow-up. So, it really is, and 1 positive for breast cancer, 1 positive for cervical cancer. It's really good that we have this program and can catch these cancers at an earlier time for treatment to occur. Healthy Neighborhoods Program, maternal child health. We're kicking off a new version of our maternal child health program. So this was for half the year. We're really working on continuing to, the big picture is to have every baby born in Cayuga County have a phone call from the health department, and every mother receiving prenatal services to have a prenatal referral. We're continuing to work on increasing our prenatal referrals. Auburn Community Hospital, we've had 100% of the babies born there. We get referrals. We haven't yet reached out to our other regional hospitals, but Cayuga Medical actually and Auburn Community Hospital, we get 100% of the Cayuga County mothers who deliver there refer to us for a phone call and then services if appropriate. The lead program, 2022, you see that there were 91 children that we've been following. Those are children who may have carried over from a previous year. There are new children who are new to the program throughout the year. We do some lead testing, and the 33 children those 33 were new during the year of 2022. WIC, you can see the clients that we serve there. Child Find is for children who may be at risk for some developmental disabilities but may not qualify for early intervention or another program as yet. I think it's good to see the early intervention numbers. Every referral has a phone call and an assessment, but the children active in the program, there are 345 of them in 2022. And of those 345 children, 78 of them receive more than 1 service. So whether they receive OT and PT or some combination of therapies. But you can also see that we have children on wait lists. And this is the first year, that was the first year, 2022, that we had to create a wait list for provision of service to these children. And it really has to do with a lack of therapists available to perform the work. Preschool special education. Again, every child receives a psych evaluation. That's part of the, it's a psychosocial, right? It's not an emotional evaluation as a requirement in the program. It's part of the evaluation. There are 287 children that were served. 25 of them went to the Cayuga County tuition-based program, for which most of them are bused. It ties into what we just passed. 14 of them go to tuition-based programs outside of the county. There are still certain children who receive services at daycare, at home, whatever their natural environment is. And again, we have a number of children on a wait list. And of those children on the wait list, it certainly could be any number of them, but it tends to be more so the children who are in rural areas. So that is disproportionately the case.
But you can't make the therapist pick. They can
Correct.
accept the assignment or they don't.
You are correct. Yes. Yeah, they have the choice. I think it's always interesting to understand the different types of public water systems that we work in and food service establishments that are permitted and inspected. We work on children's camps we've spoken about, but motels, hotels, and migrant labor camps. You certainly are all aware of bathing beach and swimming pool inspections that we do, mobile home parks. And I say you're aware of it because I know over time we've talked a little bit, perhaps not only at Board of Health things, but sometimes whenever you read a boil water order, it might be, let's say if there were an issue at a mobile home park, you would become aware of that fact, I think, when through those press releases. Septic system inspections, always good to see that. And specifically, we're keeping track also of the septic system grant program. On the septic system inspection program, you're going to see those numbers be cycle every 7 years, given the septic system inspection program within the county. Every 7 years, Cayuga County residents have an inspection depending where they reside within, where the septic system resides within the watershed. Adolescent tobacco use program. I expect we'll be talking more about that, particularly in Board of Health, but there may be some topics coming forward in the future from the Board of Health for discussion with our HHS committee. Human Indoor Air Act. We don't typically have many violations anymore for that. The waiver has been and continues to be at OTB in Auburn. We have a separate nuisance complaints. The residential lead inspections, so this ties into our children who have high lead levels. There may be more residences inspected because if the child has their primary home, but they might spend 8 or more hours a day at a babysitter's house or at grandma and grandpa's house, or 8 or more hours a week at one of those homes. And so we request to inspect those homes also to identify any lead hazards so that they can be addressed. Rabies, always busy. This is the time of year things start to uptick. And COVID-19, you can see, clinics that we held, vaccinated individuals, overtime work, etc. And there was just one more that I was just going to add. I just got this today. We asked our public health fellows to track the projects that they work on for us. So the public health fellows were they're contracted employees funded by it's federal money that goes to the state that comes to the localities. And the fellows that we have working, and we've had 4 of them, are all, they happen to all be college graduates who have an interest in learning more about public health. And they don't necessarily have a public health degree, and we can get them experience and give them job work. So there have been various projects that they've worked on. Some of the fellows who were hired worked during COVID as contact tracers, but there's not as much of that work to be done. We have them working in a variety of other projects. So for example, we had at least 50 projects they helped early intervention with, along with some ongoing work. They helped do some auditing of early intervention and preschool charts. They help, for those of you familiar, there's a lot of paperwork that goes with some of these programs, and they created, fillable forms for us now that can be done online. We can send to parents ahead of time. So it's very, they've helped us create some efficiencies. They've worked on a number of environmental health projects. Like this PowerPoint that's being created and presented was put together initially and drafted by one of our fellows. And they work largely with health education. They've done at least 93 different projects there. They're really helped us get Healthy Neighborhoods program up off the ground and doing home visits. And they are the people often making the videos that we try to put on our social media, the 15, 30-second slots. So it's really brought a great infusion of energy and different perspectives working with these fellows. Of the 4, one of them we were able to hire on in one of our health educator vacancy spots. So that was really great because we had a chance to work with this person and she works well and she qualified for that position and we were able to hire her. So that's part of the purpose behind the fellows program also. So.
Elaine, I got a couple of questions. Can you go to page 4, the Lyme disease?
Yes.
That you hear about it all the time, but we had 118.
It's
in 2
shocking.
years
I'm
compared to
glad
last
you brought
year.
that up because yes,
That's an awful lot.
it's an
isn't it?
awful lot and it's endemic. It's endemic throughout our through New York State now. And, we try to do education to in various means, but we always sent like at the end of, toward the end of each school year, we've been sending information about mosquito bites and tick bites to school-age children, the 5th graders and under, because they tend to be the ones who bring their papers home with them. And we give them to every school district. So at least there's one way that we're reminding families about the importance of tick prevention. And it's not a joke that they say when you go for a hike, like wear the long sleeves if you can, check your, keep your hair in a ponytail, check for the presence of ticks because, that's the most prevalent tick-borne disease that we have, but certainly there are others that occur as well.
I guess the reason I ask is I think everybody maybe knows Nicole Somerville on Channel 9. She's my daughter's best friend. She has that and had it for years and nobody ever found it. Nobody ever tested for it.
Is it clinically diagnosed or is there a blood test? I mean, how do they? It's a
Well, I
clinical-
certainly wouldn't speak to all of that, right? A lot of times it can be clinically identified. And of course, when you have that
If you have to-
telltale bullseye,
Mhm.
that's a giveaway that you should go and get checked because often if you can be immediately identified, there are some antibiotic treatments that can help with some of the effects
She
of it.
didn't have that. That's a problem. So
That,
they didn't
and it
test
can be
for it.
rather complex. It takes a long time to identify sometimes
Yeah.
what the
Years.
cause of the ailments are. And then when it's identified as Lyme, there's such a spectrum of issues that can come along with that.
Okay, I appreciate that. That stuns me that there's 118 in our county. You always hear
Yeah.
about it. And one more question.
Yeah.
Page 14, with the rabies,
Yes.
who enforces the 10-day and the 6-month confinements? Do
The health
So-
department.
your department does that or?
Yeah, no, we do it. We do it in a number of different ways. So we have a part-time rabies coordinator who speaks to the owners, the pet owners about this and conveys the importance of it. We will sometimes do a FaceTime chat like randomly to say, show us that your dog is confined.
Mhm.
But we more often make home visits
Really?
to verify that. We do. And it's our environmental health staff who will go out and make home visits.
And that's all connected with having a dog bite naturally, right?
Well, having an exposure, so if your dog has had their vaccinations, there may only be a need for a 10-day monitoring because typically if you've been exposed to, like it got in a scrap with a raccoon, you're typically going to see effects from that within 10 days. But if your pet has not been, say, old enough to be vaccinated yet, you got to often confine them a little longer. And I might give you the inaccurate information, so I better stop talking, but I can get you information about that.
Yeah, I'm kind of interested.
Yeah.
What if the families do not confine? Can they be fined? Can they be sent to a hearing and fined?
For sure, that would be one way, but more also we'd have to put up those dogs in a kennel or somewhere.
Okay.
I'm saying dogs, could be cat, could be
Right.
some other pet, right?
Thank you for that. Appreciate it.
Just have a question about the wait list for EI. So these 56 kids that are on our wait list, so they haven't been initially evaluated at all, or have they?
They would have been evaluated and they would have had an IEP, an individualized education plan identified for them. And then that may say 2 PT visits a week and we don't have the PT.
So they've been through the queue, they've been through that initial.
Correct.
Okay, so they do know what to focus on if they decided to go private or go somewhere else.
Well, you actually reminded me of something else that I think is worthy mentioning. One of the things that we're trying to do, because in particular, because there's a wait list, but really for every family, is through our Children and Youth with Special Health Care Needs grant, which is far expanded this year. And we contracted with the Play Space. And with Play Space and our early intervention service coordinators are working very closely together. And we just last week had 2 events. One was for early intervention aged children, so the birth to age 3, and then one was for preschool age children, age 3 to 5. And a therapist came in and spoke about things you can do with your child. So even if there isn't something, even if you don't get the one-on-one, as like you said, as families, you can learn some things you can do to help your child's development. And they got to play. And we're working on doing videos of telehealth and how successful telehealth can
Oh,
be.
wow, that's great.
And that's something we've got a really nice video of one therapist working with a family. We're just working to figure out what we can do to condense it to put out on our social media site because they've all given permissions for that. And so we want to encourage parents to.
Here's the things you
take
can
advantage
do
of
with
that also.
I saw that number and I was like, I hope they've been identified and parents can have at least a handful of resources. So perfect. Glad to hear that. Thank you.
So is it mostly physical therapy? Is that the therapeutic component that's missing?
I don't know. I don't know. I'll find out. I don't know what the longer one. We actually were just talking with our staff about how we might best prioritize children. So we're thinking of kind of getting a whiteboard, so to speak. And I may ended up doing it differently, but this was some of the ideas. Identify where the family lives and the therapies they're eligible for, so that if we do have a child, say, who ages out, so then a therapist can take on another case, not just who's been on the wait list longest, but also who's got multiple therapies but is getting nothing. So then at least a child who may have multiple therapies can get one. And if your OT goes in to see you, they can probably offer some general PT. It's not part of their script, but they could probably help teach the families and educate the families about some things. They can't work outside their scope of practice. I don't want anyone listening to think that, but it's helpful and link people into other ways they may be able to support their children.
I will confess that I had another child over to play at the same time that my son was getting his services, and they benefited from the services because they didn't have a provider. So it was one-on-one. He observed as much as a 2 and 3-year-old can observe. So that, and then vice versa happened so that we could make the most of kind of,
It's really great.
stay in closer ears on that one, but.
And I think the providers certainly appreciate that. And it's not necessarily complicated ways you can help your child, right? But you need to learn that. It's not instinctive within every parent. They don't necessarily know these things.
Great job putting all this together. Sure.
This is great. A lot of credit. Megan Bell really worked with everybody to put this together. So we appreciate getting that out this year. I mean, and of course, here's my report under my folder.
Thank you.
Thanks, Kim.
Christine?
Oh, Jim, do you have your hand up?
Yeah, yes, I do. Can you hear me?
Sorry, I didn't even see you. Yes, go ahead.
No, that's okay. I'm kind of doing it stealth-wise tonight. That mention that Aileen just made about and Kathleen about doing, did I hear video type conferencing
I think she.
as a means to reach some of these kids?
Telehealth is something that is now eligible for therapy. And so if there is a therapist in Syracuse who can't drive to Moravia, but could take on a client, if they're willing to do this telehealth, for example, we want to encourage parents to consider that as because that at least their child will be getting services, but really it can be very effective as long as, their adult is with them to help with the process.
So of the 56 that are outstanding, have we checked to see how many of them have access to broadband so that they could take advantage of something like that? Do they know that that's out there?
So the
And
service
that
coordinator,
sounds like a dumb question, but
no, it's not a dumb question. That absolutely is something that our service coordinators, that is their job, to work with families and let them know their options. It's not automatically an option though, right? We still have to have the therapist who has the time in their day. So when we have a therapist with time in their day and one of them says, you know, we often will say, can you accept this child who has these needs and they live here? They'll say, I really can't, but you know, I might be able to do this. Most of the
Okay.
therapists are doing one-on-one in person. There are some of them are doing telehealth, and when that is available, we absolutely not only keep our families there, but we really work to encourage our families to take advantage of that opportunity.
okay, thank you.
Thanks.
Thank you. Christine, you have 3 resolutions tonight. You want to go through H6, the of a caseworker vacancy?
Yeah, so we have a adult protective caseworker who is retiring, and we are looking to fill that position. It's budgeted.
Okay. Why don't you go through all 3?
Okay.
Yep. And then
Simple
we'll,
one. So the HH7 is, we're looking to, this isn't just like I did last month where we have to come in and create this human services examiner's help program position due to a vacancy. We had termination, actually somebody didn't make it through probation. So asking for this to help human services examiner position to be created. I talked about this last month, but I'll just review that the help positions are non-competitive.
Right.
And they only last for 1 year in duration, that someone's able to be in that help human services examiner position. Then they have to be reclassified to a competitive health human services examiner title at that 1 year mark. So if we, so we're not asking to abolish the regular
Competitive.
health, the human service examiner positions, because if we did, then we would have to do a whole bunch of things like do a new position duty statement, go to Civil Service Commission to classify the position, and then come here and ask for the creation of the position for each one of the health positions.
we were hoping when you did the 6 of them, you wouldn't have another resignation, but you do, and you have to take the same
Yeah.
process.
Yep, so in bottom line is we will never have more positions for the human service examiner than we have funded in our budget. Okay, so that's that one. And then we are looking to fill a attorney position
Due to a vacancy.
due to a vacancy. We had one of our social service attorneys left to take a position.
Could we get a motion for HH 6, 7, and 8?
I'll move the bundle.
Second.
Okay. Any questions on any of those resolutions?
Elaine?
Yep.
How many positions are you down? Do you know?
In the
whole
department as a
department.
whole, not as many as we were a few months ago, but we have some. We're trying to fill a human services examiner, caseworkers.
Examiners are the hardest.
No, not necessarily. Actually, we're doing pretty good with the examiners right now because of this help position where they don't have to be tested.
Yep.
But it's, it's kind of unfortunately a revolving door with, with positions right now. We have folks that are coming, folks that are leaving. It's been like that for a little while. But key positions that we have is still Director of Administrative Services
What about the attorneys?
and.
That's
two
not going to be
attorneys.
easy to find 2
No.
attorneys.
It's not going to be easy.
Are you interviewing? Do you have people to interview, at least to discuss the
We have
jobs?
one applicant so far for the attorney position, and very concerning. We have a lot of court work. We're actually meeting tomorrow with the county attorney's office.
Yeah, they're helping you out, which is
to,
great.
Talk about some specific needs that we have around court dates that were double booked for, and trying to kind of nail down some help that we have to kind of get through and talk about some ideas, but it's
You haven't thought of contracting. I mean, you're not looking to contract it out, but that could be something you might have to do at
talked about
some
it
point.
today, like
Yes.
maybe we need to go that way. I mean, in particular, I think the what's hurting us is the assigned counsel rate.
Yeah.
Going up.
Yeah.
In the
Yeah.
governor's budget, and
Sure is.
a lot of attorneys, stand to make quite a bit more money, doing the sign council work than they would being a DSS attorney or a county attorney for that matter.
Yeah, that's been talked about a lot. Okay.
Thanks, Chris.
We have a motion and a second. All in favor?
Aye.
All right, great.
I just have a couple of things to mention. I think I talked about this a couple of months ago, that with the federal emergency around COVID ending, people that are in receipt of Medicaid, Child Health Plus, Essential Plan, and the managed long-term care will need to be renewing their health insurance coverage. So you may have constituents that they should be getting notifications in the mail. The first set of notifications have already gone out. And there's a small window of 30 days. They need to do the recertification work to maintain their coverage. We do anticipate that there are going to be people that lose their coverage because they haven't updated their address. There's been some work done to try to make sure that people update their address, but I think there are going to be some folks that end up slipping through with that and get notifications their coverage is ended. And so there's going to be some work that needs to be done to link them back up.
You have to research the managed care cases or just traditional Medicaid? I
Our
saw
Medicaid here was, we do the
the
Medicaid.
traditional.
Yeah,
Okay.
but there was like Fidelis was out just
I
recently.
saw they still,
did you
yeah,
see it?
and it was in the paper.
Yeah, so they were out to just do some awareness and make sure that people understand this is what's happening. And it's very important that you complete the paperwork that, is sent to you timely. So that's kind of on our radar.
Chris, is there anything we can do so these people do not lose their coverage? Is there any extra help you need to do that, or we just don't want people losing their health insurance?
Yeah, I don't,
Maybe
Well,
the providers, really.
yeah.
It's a
Yeah.
big deal for the providers too, because then they can't bill anyone.
right. I don't think that there's anything that we can do. I mean, I think there's a lot of social media information out there. There's
Okay.
information on the TV, where there's been information that have been sent out to people to like make them aware that this is coming.
All
So I
right.
think there has been some proactive work
If you
done.
need any help, let us know, please.
Lydia?
Thank you. Can you please tell me what are the parameters of folks who are losing their coverage? I mean, it's not everybody who is on New York State Health, right?
Well, it would just be if they don't recertify, so if they're not recertifying and providing the information needed and information about their income and, their current, circumstances.
Are these traditionally Medicaid cases that you're referring
Yes.
to? You're referring to the
I'm
Medicaid
referring to
case
Medicaid.
because that's the program that the Social Services Department administers. They don't administer any private insurance, so these would be Medicaid eligibles in the county. And if they're on managed care, the managed care organization can do the recertification. If they're on traditional Medicaid, it has to go through the Department of Social Services.
yeah.
And
And
And some of these folks, I think I had said before that some of these folks have maybe not gone through a recertification process ever since they've been on,
because of
Medicaid.
COVID.
Because of COVID,
Yes.
that was suspended so it was for years essentially. So this is their first time, having to go through the process of a recertification.
And it's not a face-to-face, but it's renewing the paperwork.
and if I could ask a follow-up, why wouldn't somebody know that they have to do this?
Why wouldn't they? Well, I think that
Yes.
if someone doesn't kind of follow social media, maybe doesn't have, watch television that much and see things that are put out there, and their address has changed. If a notification was mailed to them at an address they lived at 2 years ago, they might not get the mail to know that this is their recertification.
That happens a lot, right?
Yes.
The
Yeah.
changes of address.
Mhm.
Thank you.
Thanks, Chris.
And the other thing I wanted to mention is that May is Foster Care Awareness Month. And, just so that you're aware, we have about 111 children in foster care right now. And, definitely children that have, been removed from not so great circumstances. A lot of children in foster care due to, family system issues around substance use, mental health concerns from the parents. And, we take in these children, try to find relatives or supports that they already have in their life to take care of them. And we're pretty successful at doing that. But we also have children that don't have those resources available to them, and they're placed in foster homes. And we do have, a number of foster homes, through the county. And, those folks do a great job with taking care of these children in need. A lot of work that goes behind the scenes here at the department too, to help, make sure that the children have what they need, caseworkers, supervisors. We have support staff. We have a lot of contracts that work with our foster care youth, and a lot of community partners too. Health, mental health, dental, the schools. We partner a lot with the school districts when children are in foster care to make sure that the kids have what they need. If they need assessments done, they need help, getting hooked up to supports in school. So it's a pretty big system and a lot of working parts. So very proud of the work that we do here with our foster care program.
And even with or without placement in foster care, you're working very closely with the school districts now about truancy and
Sure.
identifying kids and,
Absolutely.
yes,
Yep.
I know you've been doing a lot of that work.
Christina, you've started the peer support piece for families involved in addiction. How is
Yep.
that working?
We've had, we're meeting just about every other week with Next Ride for Friends. We just had a meeting a couple of days ago and met and talked about how it's going. They have received a few referrals from us. We're kind of ramping up. Talked about 4 more families that we're going to be referring to them. I think that we knew that it was going to be kind of challenging, that, these are tough families. And when parents have their children removed, they're often in a really bad place. And that's why we really thought that the peer would be a good support to be able to connect with them, link with them, in a non-threatening way, someone that understands what they are going through, and hopefully continue to have them be engaged with us to work. We have a very short timeline, before we have to try to achieve permanency for a child. So they can't linger in foster care for years and years while someone is, working towards maybe recovery or being stable and being able to safely provide care for their kids. So it's very important that when kids come into foster care, we're doing everything we can to help the parents get on track right away. And that's not always easy when people are dealing with, substance use disorder and mental health issues.
Where are we? Did we get a motion in a second? We have to vote? Okay, we did get a motion in a second. Okay, all in favor of these 3 resolutions?
Aye.
We already did. You're just giving the report. Okay.
Okay, thank you.
Yep.
Thank you.
Thank you.
Liz, do you want to, this is covering for Lauren tonight. You have the resolutions in front of you? Do you?
I don't, I don't have the numbers. I have the
Okay.
resolutions, but
Okay, all right, we can start with.
There you go. Yep.
Great.
I have them now. So HH 9, authorizing the filling of a full-time senior clerk position at the Community Mental Health Center before the vacancy. So, excuse me, we have a senior clerk who will be, excuse me, leaving her position at the end of June. And we're just hoping that we can hire somebody 2 to 3 weeks prior to when the person actually leaves, so we can do some training.
All right, can I get a motion for HH 9?
I'll move it.
Second,
I guess second.
any questions about that? All in favor?
Aye.
HH 10, authorizing the chair of the Cayuga County Legislature and the Director of Community Services to enter into a contract for mental health counseling. This is just, we have, in our budget, we have 3 contract therapist positions, and this is, we have 2 of those that are currently filled, and this is just to fill the 3rd position. That position will start the end of May, we're hoping.
We get a motion for HH 10?
We'll remove it.
I'll second.
Okay, any questions about filling this? All right, all in favor?
Aye.
Great.
HH 11 is authorizing the Director of Community Services and the Chair of the Cayuga County Legislature to sign contracts with various agencies for substance use and mental health services funded by opioid settlement funds. The legislature, I think last year, decided that they were leaving it up to the Community Services Board in terms of what programs to fund with the opioid settlement funds. And the Community Services Board members have been reviewing the grants in response to an RFP that was put out last year. I think so far it's been agreed to fund 4 to 5 different programs. And so this is just authorizing the director to enter into a contract with those.
Do the counseling for that CASA program.
Is that
correct?
just for, yeah, and
Yes.
we've already done 3 others.
Yep.
Yep.
And this is
So
a,
this is Cayuga Counseling Services to help provide funding for their CASA program. I think they want to add an additional staff person, and the CASA program works with families who are affected by substance use.
and it deals with the children and helping them deal with that. Yep, okay. All right, can we get a motion for HH 11?
I'll move it.
Stein, yes.
Any questions about this? All right, all in favor?
Aye.
HH 12 is authorizing the chair of the Cayuga County Legislature and the Director of Community Services to accept funds and enter into a contract with trustees of Dartmouth College for a research project. We were approached probably at the end of last year by Dartmouth to participate in a research project for to work with families who have children who are receiving medication services at Cayuga County Mental Health. And the project is to really focus on family-centered work, particularly by the prescriber. So for this study particularly, we have 3 nurse practitioners who have said that they want to participate. And it's really, the goal is to provide family therapy to reduce polypharmacy in the youth that are receiving the services.
So young kids getting antipsychotics. And a lot of
Antipsychotics
things.
and more than one psychotropic medicine.
Great. And, okay, this is just taking in the 20.
It's just taking in money, and it's basically, it's not adding to the salaries of the people who are participating in the study. It's basically just Dartmouth is providing us $22,000 for any time that the nurse practitioners will spend in meetings or consultations, or if a session goes a little bit longer than it normally would with a family and a child.
That's great. Okay, can I get a motion for HH 12?
I'll move it.
Okay, any questions? I think it's great.
Yeah, it's really.
Yeah.
I have a question. How did this come to be? Was there a survey?
Dartmouth would just basically reached out to us. I'm not sure how they connected with us. Right now, we are the only clinic in the country that's participating in this study. So I have no idea how they came up with our
Are there other mental health
Exciting.
clinics serving as many children as yours?
Oh, yeah, like throughout the state, not in this community.
Right,
or,
right.
But
Yeah.
throughout the state, there definitely is. I mean, there's a lot of clinics that are a lot bigger than ours. However, in this region, we're probably one of the largest.
Yeah, thanks.
Just a couple other things. Our daytime mobile
Yeah, all in
crisis.
favor of
I'm
this?
sorry.
Yeah, no problem. All in favor?
Aye.
Our daytime mobile crisis programs finally started on April 17th. We've gotten calls from the police department. We're connected now with 911. We've gotten some calls from schools. So we're very excited that that's finally started. And the way to contact us is just by calling our main number, and it's number 9 prompt. And the calls will be directed to mobile crisis. And Monica, we included data from Healing Communities. I know she's coming at the end of the month to present to the whole legislature, but she wants everybody to be aware that they've created a dashboard, and the link is here, and you can go on the dashboard and get really good information. Narcan distribution continues, even though the Healing Community study itself has ended. We've received other grants and grant money, so that work can continue. Narcan distribution, which is vital in saving lives, continues across the county.
Can I ask a question, Liz? You now have a number that people can call directly into mental health if there's a mental health crisis without calling 911.
Right.
How does the issue with the iPads in the sheriff's department work? That's
going to be separate.
Totally.
So our mobile crisis, that's considered a separate program from the clinic, even though there's going to be a lot of coordination. But the iPad program, those calls still go right to the clinic. So in the clinic, we have every hour, we have somebody we call a clinician on duty that take either a walk-in if it's for an intake or accept crisis calls. So if the sheriff's call, the clinician on duty in the clinic will respond to those calls.
So if the sheriff, if 911 is called and the sheriff responds and they realize it's a mental health issue, they can kind of iPad in?
Yeah, I think what the sheriffs will always be, they'll be on the location. So they'll still respond, but if they think that it needs a mental health intervention, they'll then contact us with wherever they are on site with the client. They'll contact us.
But the sheriff won't respond when they call mental health directly, or they will?
Well, so the iPads are there with the sheriff.
Yep.
The sheriff gets a call. The sheriff goes to the location with the iPad. They'll make a determination whether or not they need,
yeah.
So at that time.
The link.
But for mobile crisis, when we're actually going out, we won't necessarily have to have the police there. Somebody could call our clinic directly. And then mobile crisis will do an assessment over the phone. Now, if they think that there's a safety concern, then they may call the police and ask the police to meet us there. Or a lot of the calls we've gotten so far have been from the police. They're already at the location, or they've been there. They've made a determination that it's safe, but there needs to be a mobile crisis response.
Okay. So the public hasn't really gotten into the whole call directly yet?
Not yet.
Okay.
And we really haven't done a lot of public. So. Yeah, and the Bureau of Justice Assistance Grant, Christine talked a little bit about that. And that's really just continuing some of the work with the healing communities, and just really the goal is diversion for people that are using substances from the criminal justice system. Children in foster care, parents who have involvement with the child welfare system.
I don't know if it's in there or not, but Monica has also just written for SAMHSA grant,
Yes.
and that's like 2
Yeah,
million.
we haven't heard,
Yeah,
we haven't heard about that yet.
but yeah, great.
She does a great job. Any other questions?
Thanks for,
Thank you. Thank you.
tell Ray we said hi.
Hey, Brenda. She tried to let you go first, Deb, and she talked about you. Sorry. All right, you have 2 resolutions tonight, Brenda?
I do, yes.
Okay. Let's see. Would you start with your first one, HH?
Okay. So the first resolution is, it says create a fiscal officer.
Oh, yes.
Yeah, I apologize in my rush. So this is that position I've been trying to fill. We knew there was going to be a retirement in December. So back last June, I had talked about filling it. We didn't get any, we weren't able to fill it. Then we changed it to a fiscal officer. 6 months have gone by, I've got no applicants, so I need to put it back in again. That's all this is. And in my rush to get it on this agenda, I forgot to take out the create, which we did last time. So we just need to fill it.
Yeah, could we make could I make an amendment to get rid of the create, because it'll cause confusion at the Ways and Means meeting for no good reason.
Right.
Okay, maybe we could just strike that.
Yeah,
But-
well, you gotta put it on the table first, then
Okay.
make your motion to amend.
If-
I'll move 13.
Okay,
I'll second.
I'll second.
all right. All in favor? Dr. Dick?
No.
No?
I'll move to
Can I
amend.
want to
All
move
right.
to amend?
I'd like to make a motion to amend HH 13 and remove the create, to create and in the resolution, and
I second.
Now you vote on the amendment.
I'd like to vote on the resolution as amended.
No. You're voting on
The amendment.
making the
Oh,
amendment,
my
making the
God.
amendment. Then you vote on the resolution
This is
as amended.
Okay.
2 steps.
All in favor?
Aye.
Thanks.
I love it.
I'm just helping you.
Yeah.
I'm like, now we'll vote on it.
All right. Okay, so you need permission to refill it again. It's been 6 months.
Trying to fill it.
Yep. Okay. And then your last resolution?
No, we need to vote on it.
We need to vote on
Oh,
it
no,
as
we have to.
amended, right?
Can you vote?
Okay.
Let's vote on this as amended. All in favor?
Aye.
Any opposed? Great.
Good job.
Second resolution, this is one that went through the Civil Service Commission. They looked at the job functions of 2 of our aging services specialists, determined that they were more appropriate fit under the specifications of aging services coordinators.
So I'm looking for the legislators to approve that, that process. The one thing I do want to point out, I don't know if you want me to discuss yet or you want to.
Go ahead.
Okay. The one thing I want to point out with this is that we are not adding anybody. This is just reclassifying 2 staff. I did check with HR and civil service to very carefully make sure that I didn't need to put in here abolish, because I know that's really important. And because this is, the numbers are in there, the position control numbers are in there, it means that those old titles really aren't going to exist anymore because they won't have a position control number with them. So I hope that makes sense. But that's why that additional language is not in there, is because those positions won't be valid any longer because they've been reclassified.
I'll move it.
Second.
Any questions? All in favor?
Aye.
Thank you. I don't have too much else to update other than we have our volunteer senior citizens of the year will be recognized at the May Ledge meeting. So that's always a really nice thing to be able to bring in front of this group. And we have our volunteer recognition picnic out at the Oscar Park in June. So I may mention that again next month, but we're just planning and work for that. And we love taking care of our volunteers with that event. We get some donations and door prizes and different things. And it's a really nice event coming up. So, and I'll just mention that fiscal, not having a fiscal person, we do have somebody helping us out, but as across the county with all the different departments that have some vacancies, it's really significant for us. So I continue to really hope that we can get somebody in there. All right.
And that person helping out is Abby, right?
She's great, yeah.
It's Abby Goodman. She's
Okay, any other questions for Brenda? All right, Deb, you want to we did talk a little bit about.
Thank you.
Thanks, Brenda.
Thank
you.
Yes. I don't have any resolutions, as you see, but I just had a few updates and a couple of updates to my updates I'd like to share with everybody. First, our first youth advisory board meeting was 2 weeks ago and it went really, really well. I was going to try to keep it to an hour, but there were so many great ideas and brainstorming thoughts and wonderful participants. So I really want to thank Lydia and Heidi for helping me with that first meeting, and your leadership was really important and it made me feel really good that you were there supporting me. So thank you.
Thank you, Debbie. You did a great job. You were amazing.
We all looked together as a committee and we looked at the bylaws. We do have some minor changes that we're looking to make to our bylaws that work out best for our board, especially with our youth members who have some, everybody has different schedules as far as meeting, but we do have our youth members who have part-time jobs, who are student athletes, so it's harder for them to meet. So we're looking to do some exceptions with allowing them to Zoom in. One other thing our board is working on currently, I'm looking to schedule our next meeting. I did a poll out. It looks like May 22nd is going to be the best date for that. And at that time, we're going to determine what our allocations are going to be for the OCFS funding. They're due into the state by June 1st. So I'm hoping to get back together with the board. And we're going to determine what those allocations are going to be for this current state fiscal year. The Governor's Youth Council is still taking applications. They'll probably be coming in for another week or so at the most. I will be looking for some of you to help me with the judging. We do have to have a judging panel for those right now. Just to update you, I do have 6 applicants in. At the beginning of the week, it was 3. So just to kind of give you a breakdown, I have 3 from Auburn High School, 1 from Moravia, 1 from Union Springs, and I think 1 in from Jordan Elbridge. I haven't checked yet today,
Yes.
but there should be another one there from Jordan Elbridge. So that would be 6 that would go on that we would judge, and 3 actually get put onto the state for the state to do the judging, and they would ultimately select 1 representative from Cayuga County to be on the Governor's Youth Council.
So we're the pre-screening and then go.
Yep. So if we only had 1, it would be a lot easier, or 3, but we have to do 3 on. So as of now, we have to get the 6 down to 3 and then move those on. The New York State budget, I mentioned, the youth bureaus were funded again. They're really supporting the youth bureaus. And one thing that's new that I'm going to get some more information on, we had a meeting the other day and it wasn't that clear, but they are adding throughout the state $10 million in new sports funding. It's actually going to be for not-for-profit sports teams.
So that's really exciting. I'm not sure what our allocation is going to be in the county. You're the first person I thought of. So I think that that could be something really good that we could have here in the county to, in addition to our youth education programming as well as the youth development programs that we do. Hopefully in June, I'll have some resolutions here for contracts that will help with the OCFS funding and to supplement some of our ARPA funding as well. Does anyone have any questions?
Lee, just a comment.
Sure.
I said, you weren't here yet, Deb, but I said what a great job Lydia and Heidi put down for the board and dedicated for that. We've had an opening for the state youth board for a long time, and it hasn't been filled from Cayuga County, right?
There was somebody in it, apparently I wasn't aware of that,
Okay.
and that person is graduating college. She went, I don't know where she is from. Someone from Oswego County told me about her, so I think she was from up in that area, and she's getting ready to graduate. She probably already did Temple University, so she's kind of aged out.
Okay,
Aged
but I
out.
want to thank you for
Yeah.
bringing that up again. And
Okay, yeah,
letting
no, it's
Cayuga County
exciting.
be
A lot of people
represented.
weren't aware of that, so
Yeah,
I'm glad that we
exactly.
can get some.
6 people, that's a lot of interest,
Yeah,
I think.
yeah, and it's really interesting to look at the applications and what they've been doing in the community. And they have part of the application process is an essay, so that's really interesting to kind of see their perspective on what leadership means to them in the community. So,
Well, this legislature's done a lot over the last few years, and I think this is one of the most important things. I really do, to have a full-time youth director and have a youth board and be active. These kids in our county have been underactive for a long time and underrepresented for a long time, and finally, they are going to be represented.
and I'm,
And we really appreciate it.
thanks. I'm excited for the board. Everybody had such great ideas. We probably could have kept talking for another hour or more because everybody just really brought a lot to the table and brainstorming and things that we might not all have thought of. So it was a really productive meeting, I think.
Great, thank you.
Thank you. Thank you. Good. You get a motion to adjourn? I'll move it. Second? All right. All in favor, motion.
Enjoy your night.